Hi, I'm Dr. Jack West, and I'm a medical oncologist with a focus in lung cancer at the City of Hope Comprehensive Cancer Center in the Los Angeles area. I'm also the founder and serve as president of Global Resource for Advancing Cancer Education. And this is another one of our series on COVID and cancer. I'm very happy to be joined today by Dr. Benjamin Levy and Dr. Jared Weiss. So let me turn it over. I'll have Dr. Levy introduce himself.
I'm Dr. Benjamin Levy, and I'm Associate Professor at Johns Hopkins School of Medicine and the Clinical Director for the Johns Hopkins Sidney Kimmel Cancer Center at Sibley Memorial in Washington, D.C.
And Dr. Jared Weiss.
I'm Jared Weiss. I'm a medical oncologist specialized in thoracic, Associate Professor of Medicine at UNC, Section Chief of Thoracic Oncology there, and Vice President of GRACE.
One of the other issues is that the world is opening up in many places. I'd like to get a sense of what it's actually like. We just opened up in Los Angeles, or more broadly in the state. You know, masks are no longer required. They almost every 48 hours, it seems that they're coming down more and more beyond what has to be done, but people are trying to pick up on what the norms should be. I'm interested in whether, well, both what are things like and what are you telling patients about how much or little they can resume their lives, go out for dinner, hug family members, travel again, versus the uncertainty and being cautious and conservative and saying, don't, you have cancer, you're on chemo, why don't you just play it safe for a while? Ben, how about you start here?
You know, so DC, Baltimore opened up probably 2-3 weeks ago with, dining experiences are back to normal. Museums in DC are not yet open yet, but they're coming out in the next week or so. There's some timed entry issues right now, but it's going to open up in the next 2 weeks. I have said to patients that, I do my best to be consistent with CDC guidelines, which is that you can resume activities without wearing masks or physical distancing, except where required, which is a little bit, flexible. I think that people should follow the federal, state, local regulations. But I think it's fairly safe now to assume that if a patient says to me, I'm vaccinated, can I go to dinner with my loved one? And, should I wear a mask? I'm like, at this point, if the restaurant allows for unmasked folks to go in, I'm okay with it. And that's following the CDC guidelines if you're vaccinated. If they mandate based on the fact that they're a very cramped restaurant or a cramped area, then I think it makes sense to continue to mask. I mean, this is where it gets controversial, to mask or not to mask, and when to mask for vaccinated patients. So I have actually I've looked through the CDC guidelines multiple times. They're vague, but I've been supportive of patients trying to get back to a normal life, visiting loved ones. If they want to travel and they're vaccinated, I'm okay with that. If they want to go to a restaurant, I'm okay with that. I think that it's been a long 12 to 15 months, and I've been supportive for patients getting back. I think the data speaks for itself for vaccinated patients. I think that we need to be supportive of that and in line with what we're seeing in these outcomes. So perhaps I'm a little bit more aggressive than others, but I think it should be getting back to normal when allowed by the local institution or government or territory.
Well, I would say there's a lot of variability based on where we are. It's changing over time. So there isn't any dogma here, that's for sure. And Jared, I saw you nodding seemingly in assent. A lot of this is, do you resonate largely with how Ben presented it, or where are you different?
Oh, absolutely. As oncologists, every day we think about quality of life. That's prime in our mind. Hugging your grandkid is a massive part of quality of life, right? So we're used to thinking about risks versus quality of life. And we're data-based people. We're used to replacing our opinions, our biases, our intuitions with what the data actually says, right? So when things started opening up, I will admit that I was very hesitant about it, right? I still wear a mask in public, even outdoors, because I have an emotional reaction of fear and I'd like to be cautious. And frankly, I don't think wearing a mask is a very big deal. But if you look at the actual data driving the CDC's guidance, it's that the data is that vaccines are insanely protective, right? And it is fine to do these things. And so if we're going to be data-based people and stick to that, I think we have to tell vaccinated patients that this is okay. That said, I think some of the things to be cautious, like if you're going to go out to eat, choosing to dine outdoors instead of indoors, particularly if you're indoors or in a crowded place, putting on a mask. I don't know, for myself and my family, I don't find these particularly harmful things. I also don't assume that everyone out and about is without a mask is vaccinated. I know that's not true because the proportion of people I'm seeing out and about are greater than the vaccination rate in my state by a lot, right? So the CDC guidance is that you can be maskless if you are vaccinated. And so I think there's a community responsibility component that protects everyone that's not really being followed through on. I am parent to 2 6-year-old girls and 1 2-year-old girl. They are not vaccinated because it is not yet allowed, right? So that is something people are ignoring, right? They're taking their kids out in public because they're vaccinated. They're assuming everyone else is vaccinated. So there are nuances here, but the data for strictly vaccinated people around other vaccinated people is that it's fine. And that data is powerful.
It's interesting. There are some things that are kind of carryovers. We have a lot more outdoor dining options, and I'm certainly in an area, and I think you're both in areas that are pretty nice for outdoor dining a lot of the year.
Yeah.
I wonder how much of that will continue beyond. I got a puppy during the pandemic, like many people did, and we spend a lot of time with her and take her to the restaurant. So now I spend more of my time eating outdoors just because she sits under the chair or the table most of the time, and there's enough places that have that, it works. I do wonder, certain things, work from home and telemedicine and some things that were adaptations to an acute situation may be sustained a long time.